Hello, everyone. It's Zai, and I am here with a
Ash.
special guest. Introduce yourself.
Ash.
And we are going to explain to you how to do massaging for your top surgery scars. Okay, now that that's off, my incisions are almost 5 months. They're going to be 5 months post-op at the end of December. And initially, here's a little bit of background information. Initially, it was very hard under here, like this much area underneath, and it was like 2 rocks right here. I was like, what the fuck? And I was cleared to start massaging at like 4 weeks. Some doctors are gonna say 6 weeks. Just listen to them because you don't want to pull too much. If it's not healed, you'll like pull your incisions too much. But we're gonna explain what we have done for my chest to fix that. There's pretty much virtually no more hardness anymore, and it went away, probably like 3 months. So products we use is bio oil to kind of like lube it up. You can use silicone lube too, and obviously I use silicone strips. The massaging not only helps all the hard buildup underneath, like all that tissue that's like damaged, but it helps to prevent keloids and stuff like that. Before we get into kind of like the tutorial, keep in mind this is something you should do pretty much every day for at least 10 minutes, or have someone else that has agreed to do it for you. Obviously that's what I did. That's why Ash is here. So Ash did it and still does it for me, which is nice. So thank you.
Love them pecs.
Ash is going to show you, but first we're going to put on some bio oil, using a few drops on each side and like one on your nipple. Here.
Thanks.
So what Ash does is like kind of pushes down to the point where you can obviously kind of feel everything, and does circular sort of motions along the incisions and on like harder areas, kind of like focus on those, whether that be like a keloid hardness or like under underskin inflammation hardness, either one. It helps to like break down those tissues. And also it's important because you don't want your scars to anchor down. They can anchor to your body basically, and when you like stretch like this, they'll like be stuck on. Does that make sense?
So to really break down the tissue, I make sure that I'm really reaching the tissue and moving it around. I don't just do circles on the very surface of the skin, moving that around, though it was more of that at first, because initially it was much more tender, and it's obviously a new wound, so you have to be careful. But after a while you can kind of get deeper and deeper, to really move that hard bit around, getting through from all sides, from the top and the bottom.
Yeah, you'll kind of like feel like harder pieces and whatnot. And the longer you massage, you'll realize they're starting to go away pretty quickly for me, actually. So
yeah, and you can really feel it if you're doing it right. You can feel the tissue break down. If you go a day or especially more without massaging, it feels kind of harder at first.
yeah.
But you can really quickly, like within like a minute, feel that go away. So I try to make sure I cover all of it by doing different motions from different directions. I do circles, little circles, big circles, do back and forth, kind of diagonally. Just really make sure I hit every spot from every direction.
So another tip, if you don't have someone to do it for you and you're grossed out like me, because it just feels gross, you can get one of these. This costed $1 from the 99-cent store. It's a facial roller. You can get different types, but this one actually works good. It's like this angle. And at first, Ash would do like this side while I rolled the other side. And it was really hard that I could feel the hardness on the little wheels. And it doesn't really feel like that anymore, and I don't use it anymore. But like initially when it's really hard, it's really good to just like roll like this. Even if you're not grossed out by touching it, I think this worked really good with like moving it around, and my scars are still a little bit inflamed here and here because I still feel a little bit of stitches and weird things. My body is like metabolizing them very slowly, and it just varies from person to person, but they don't hurt. And like I said, the hardness has pretty much almost all the way gone away. It does build up a little bit, so we still have to massage it. But yeah. Thank y'all for watching. Don't forget to subscribe. I make videos like all the time, and I hope they're useful. If they are, give it a thumbs up. And if you have any other questions, ask me, or just anything timeline specific or my experience. But yeah, I hope this helps, and make sure you massage it if you're getting top surgeries. It's not an option. It's something you really should do, at the very least. But yeah, thank you guys. Thank Ash for making my chest so much better and not feel like a bunch of rocks under my skin and pieces of cement. So yeah.
Bye.
Can you leave in you just standing up and being without your pants?
And now I don't have pants. I look so rolly. I look like a roly poly.
Oh, roly polies are so cute. You're my roly poly bitch.
I'm gonna show you guys my setup. So we have my mic right here, mounted at the bottom of a tripod. Obviously this is on a tripod, my camera. Got my lights, and I put blankets all over the fucking walls because it's so echoey in here, y'all. I don't have like a sound blanket and a stand for it, so I just pinned a bunch of normal blankets the best I can do, and it helped with the echo, but it's not perfect, so I'm sorry about the echo, but I hope you're satisfied regardless. Thank you.